Now is chat with a doctor, Sabani Sethi, who is a clinical associate professor in the Department of Psychiatry and Behavioral Sciences, about this really interesting study where they looked at how having a keto diet can improve severe mental illness. So the doctor is with us now, so we can chat a little bit about this. Thank you for joining us here this afternoon on KRON 4. Appreciate your time.
Thank you for having me.
So what is it between having a keto diet, and maybe you can describe to our viewers a little bit what that diet entails, and how that was improving the mental health of these patients that are suffering from bipolar disorder and schizophrenia and other mental illnesses, how this improved their overall well-being?
Sure, happy to. So a ketogenic diet is a low carbohydrate, moderate protein, and high fat diet. It's been well known that a ketogenic diet is effective in obesity, in diabetes, as well as epilepsy. So in the field of neurology, it's been used to treat seizures. Epilepsy is a seizure disorder. So we are looking at and have been looking at how a ketogenic diet might be helpful for other brain illnesses like schizophrenia and bipolar illness. And what we did was look at a ketogenic diet intervention in this population for 4 months and look at the outcomes, both metabolic outcomes as well as psychiatric outcomes.
So were these patients also taking any other type of prescription medication to help with their mental illnesses, or were they just changing their diet?
So each patient that enrolled in the study, and this is a pilot study, each patient had an average of 3 medications that they were on, psychiatric medication. And with that, this was an adjunctive add-on that a ketogenic diet would be on top of the medication. And so what we did was look at and observe changes in their medications over time, over the course of the 4 months. Some, maybe 30%, were able to actually decrease some of the medications. Some stayed the same, but we were really we're interested in looking at also the side effects of potential medications can have and whether this intervention was alleviating that, which actually turned out to be the case. In fact, a lot of these patients do suffer from metabolic syndrome, from obesity or insulin resistance. And so we also wanted to see how that would change over time in this study. And what we did find, which was quite encouraging, is that there was for the patients who were adherent to the diet, there was a 12% weight loss, 12% BMI reduction, 13% down in waist circumference, and visceral fat reduction, which is actually the fat that's around the organs that we consider inflammatory. And there was a reversal of metabolic syndrome in 4 months for the patients who had that.
Yeah, it's fascinating. Do you think that this also could apply to people that maybe don't have these type of mental illnesses, but just an average person? By changing to some sort of keto diet, it could have this benefit on the brain and the brain health?
That's possible. I think, more research needs to be done in those populations. And there are other ongoing trials looking at these cases. But in particular, I think what was so promising and encouraging about this study is that it not only improved metabolic outcomes, but also psychiatric outcomes. And we saw 79% of the cohort actually improve, clinically meaningful improvement. And so what that means for, these patients is the quality of life is improving, and it really gives them hope and feel like it's potentially life-saving for them. And so I think more focus on this area would be great. And I do think over time we can also look at other conditions, including eating disorders, which we're looking at, and depression.
What do you think it is about the keto diet that made this difference? The balance between carbohydrates and fat? What about keto do you think is the difference here?
So ketogenic diets have been known to treat epilepsy, like I was mentioning before, and you can either be in a carbohydrate burning state, which means you're using glucose, the brain's using glucose, or you can be in a state where with ketogenic diets, you are burning fat down to break ketones. So your body can essentially burn energy with ketones. And so what we do think is that there are some metabolic deficits in the brain. There are bioenergetic issues in the brain with mental illness. And if we're circumventing that problem, in the first place in the brain, then we're actually, providing energy in an alternative way to be able to improve symptoms, whether that's cognition or mood or energy or sleep. We looked at these variables in the study, and so that it's encouraging that moving forward we might have some good treatment options and solutions for patients with mental health.
Dr. Sethi from Stanford Medicine, thank you so much for joining us so we could talk about how this keto diet is improving severe mental illness. We appreciate your time.